for testing in the last 24 hours to 8 p.m, which is a great result. And I just want to thank everybody for that. Please make sure if you have the mildest of symptoms, you come forward and get tested. Or if you've been deemed to be a close or casual contact, you follow the health advice immediately. Last night to 8 p.m, New South Wales had 31 cases of community transmission. 13 of those cases were active in the community. And I do want to stress that this pretty much reflects the days just before and the day we went into lockdown. So what we're seeing today is pretty much a lag of the last couple of days before we went into lockdown. So we're anticipating that there could be an increase in numbers over the next few days, and then hopefully early next week we should see the impacts of the lockdown really turning and having a positive impact. I do want to stress what we look at is how many cases we've had that were not in isolation either completely or partially, and last night's figure of 13 is concerning, and that is something that we are working to address by stressing to the community, stay at home means stay at home, don't leave the house unless you absolutely have to, and please make sure that if you are a worker doing an essential job that you do not turn up if you have the mildest of symptoms. This strain is so transmissible, so infectious, that even, as we know, a fleeting passing can have that impact. I also want to stress that if you're a close contact, it means you can't leave the house. That includes for vaccination, that includes for medical attention. If you are a close contact, please ring health and health will meet all of your needs. If you're a close contact and you need medical attention, ring health. If you need other supplies you can't get, please ring health. If you're a close contact, you should not be leaving the house. If you're deemed to be a casual contact, please follow the health advice. The health advice will depend on the venue you are at, the circumstances of your family and your household. So make sure that if you're a casual contact, you follow the health advice strictly to the letter. We know the settings in place are what is needed to take us out of the lockdown, but what we can't assume is that everybody will do the right thing 100% of the time, but we need to be able to assume that. So please, can I say to everybody, please follow the rules. The rules are there for a reason. The rules are there to make sure we get on top of these cases and that we can get out of lockdown when we want to. And please know that even a few people, a handful of people not doing the right thing can have very devastating consequences. So I ask everybody to follow the health advice. If you're a close contact, don't leave home. If you're a casual contact, follow the health advice. And if you have the mildest of symptoms, please get tested and isolated until you get the health advice as to what you should do next. So can I just ask everybody to please follow these rules, to thank everybody for what we've done to date. And I will say the next few days are critical because we know that what we're doing until this point in time is mopping up in the last few days leading into the lockdown. We anticipated that. I am relieved, I have to say, that the case numbers weren't as bad as what they could have been. Often in other states, in other jurisdictions around the world with this virus, you've seen a doubling or tripling of cases, which is what we were afraid of. That hasn't materialised. But we are still in a stage of mopping up. We're mopping up what the spread may have been either on the day of or the day before the lockdown, and that's what we need to keep an eye on. How many cases were circulating in the community and have we got all those chains of transmission that we otherwise may have missed. So I'm always optimistic about the future because I have faith and confidence in the people of our state. But the next few days are critical, and come early next week, we do want to see the tide turn in terms of the number of people with the virus who are in isolation as opposed to those who've been active in the community. And that's really what we need to look at in terms of decisions moving forward.